Hi, I'm Dr. Eric Hanberg, and I'm a forensic pathologist and medical examiner, and this is Becoming a Medical Examiner. This is the first try at a video podcast, so we'll see how that goes. But on this podcast, I interview other medical examiners, and we talk about what it was like for them becoming a medical examiner and just sort of the process of getting there and what it's like for them now that they're there. And today, I'm joined by Dr. Reade Quinton. So, Reade, can you introduce yourself?
Sure. My name's Dr. Reade Quinton. I am originally from New Orleans, Louisiana. Grew up there and then went to college in Mississippi and then onward from there. But for the most part, a Southern boy until about 6 years ago when I moved to Rochester, Minnesota.
That's so interesting. Honestly, I don't think I ever would have placed you as a Southern boy. That's not how I think of you. But I guess I think of you in your current station.
Right.
So that's far from being a Southern boy, I guess. So why don't we start there? So you grew up in Louisiana?
Yeah. Yeah. So I grew up in New Orleans. This was way pre-Katrina. So I'm a child of the 80s. But my father was a New Orleans police officer. And so I grew up in that sort of law enforcement environment. And I think we always joke about for people who grow up in that environment, oftentimes there's some sort of discussion similar to what I had, which is my father would always tell me, whatever you do, just don't ever become a police officer.
Sure.
So,
yeah.
So
classic advice.
Yeah, he was always encouraging me not to follow in his footsteps.
Okay. So grew up. Actually, you know what? Like I said, it's been a while since I've done one of these.
Yeah.
So really, so the people that listen to this, they're interested in what it's like to become a medical examiner, and what I always start with, up until today, is that a lot of people just outright don't know what a medical examiner is.
Right.
And I found that I thought that I had the one true way to describe what we do, but it turns out everyone has a little bit of a different way. So when somebody asks, what do you do? And you need to explain it to somebody who isn't also a physician.
Right.
How do you explain what we do?
Yeah, it's not easy, especially because a lot of people don't even understand that we're physicians, right? So I usually start by saying, I am a physician. I trained as a doctor, but my specialty is forensic pathology, which means that I perform autopsies and other investigative procedures to determine why someone died.
I think that's nice and concise. I get a little bit deeper into it because I feel like people often think autopsies are spooky.
Sure.
You know what I mean? And so I like to talk about it being a little bit of a medical procedure, and also that it's an investigation and trying to figure out all of the medical history they had, putting together that background and that kind of thing. But I like yours because it's so concise, because I get a little wordy often.
Well, and then oftentimes I'll follow up with a definition of autopsy, which basically is, the autopsy is not just opening a body, which is what the normal public thinks, but that it encompasses the scene investigation, the medical record review, the toxicology, all these other things. And so if anybody's that interested, which usually they are, because how many medical examiners do they get to meet, but I usually start very simple.
Right. So you mentioned that's one of the things that I love about this job. So prior to this, I was an emergency medicine doctor. And when I did that, I thought I have the most interesting job in the world, or at least the most interesting job in the room most of the time.
Right.
But I have found that I truly enjoy this job, and I find it so interesting, and I found that other people find it so interesting. And, if I'm in a room with somebody who drives NASCAR and a neurosurgeon, these are incredible people with incredible skills. And then when I say I do autopsies for sudden suspicious death, all of a sudden it's my stories people are interested in. And in fairness, I also find my stories interesting. Why do you think people find it so interesting?
I think it just falls so outside of their normal everyday experience, right?
Yeah.
So when you describe even something as extreme as NASCAR driver, right?
Right.
People at least understand what it's like to drive a car. But it's the performance of the autopsy and death investigation and all the things that we get exposed to through that is something very alien to most people that they probably will never directly experience. So I think that's why it kind of captures that attention right away.
So when did that interest spark for you? When did you first decide? When did you find out about forensic pathology?
Yeah, so I usually preface some of this conversation when I'm talking to students with the notion of keep in mind this is pre-internet, which dates me.
Okay.
But when I was in high school, I remember very distinctly saying, I know my dad does not want me to be a cop, but I'm interested in something in law enforcement.
Okay.
But I'm also a good student, and I'm interested in, science and things like that. So my brain sort of naturally gravitated towards forensic science, quote unquote. But I didn't even understand what that was exactly and didn't have the resources to even figure that out exactly. So I really had to wing it and go, well, I guess I'll major in biochemistry because DNA is the big hot topic, and you start to see it all the time in the news. And I was like, well, that's where I'll start then. But even keeping in mind, a lot of schools at that point didn't really have robust criminal justice, forensic science, like those types of majors, right? So I was going with the thing I thought would fit the best. So that's how I got started.
Well, hold on. So that's really interesting. So you knew about forensic anything in high school. That's when you sort of figured out the idea of forensics existed?
Yes.
Is that through your dad or
through
what?
my dad? Yeah,
okay.
Unquestionably. I mean, it's one of those things where you organically hear stories, that he brings home from his day job, and so there was always this idea of, well, it just felt right. Like I wanted to do something in, quote, law enforcement.
Okay.
But I think I told you before, when I was in my senior year, I said, I don't know exactly what I want to do yet, but I know two things. I don't want to be a lawyer and I don't want to be a doctor.
Yeah, sure. Okay.
And so, but that was kind of how I started.
So now you do some pseudo version.
Right, of both.
Okay.
Yeah, interestingly, my wife's mother, who was a nurse, also told her growing up, whatever you do, don't marry a doctor. So,
yeah.
And I think she said, and cop, because her dad was law enforcement as well.
So you decide you're interested in forensics, and then you find, what did you say your actual major was?
Biochemistry.
Biochemistry. Do you feel like, this is another question I get pretty often, which is what major should I do if I want to go be a forensic pathologist? Would you recommend biochemistry?
No. Nowadays, it's fascinating, and I started to see this by the time I was getting into medical school, is that now, people major in anything.
Yeah.
And then go to medical school. As long as they have those prerequisites required and do well in them, to get into medical school. I met people who were they majored in foreign language, they majored in dance, they majored in engineering, Yeah. So I don't think that locks you into anything. And I really like that because there are people who discover their interest in medicine later. And thankfully, they didn't waste 4 years already, getting to that point, because a lot of their major still is fine. They just have to get those prerequisites.
I'm right there with you. I talk about my friend. His name is Sky from medical school, and Sky was awesome. He's a great doctor, and he majored in piano performance. And he had to take a couple of electives in science. And now we're both doctors, but he can play the piano. Right. And that's what's really frustrating. It's like, oh man, I could have been a dancer too.
Yeah.
But I did enjoy I just did general biology. Sure. And it was interesting. And I do think that helped in that it kept me motivated because it sparked that scientific interest in me. But I still had other interests that instead of doing guitar performance or something, I was learning starfish anatomy, and that's fine, but it's not necessary. And I'm glad to hear you say that, because that's how I feel.
Yeah.
So do you think there is, what advice do you give to people who are in undergrad who are trying to go to med school as far as what to major in, how to spend their time, how to focus?
I think the biggest advice that I give to people, because we meet so many people that have similar stories where they discover forensics very early, or forensic pathology very early. And oftentimes the people we know in our field went to medical school to do forensic pathology. And so the biggest advice I give them is, that's great, but remember, before you can do that, you have to be a good doctor.
Right.
And before you do that, you have to be a good undergrad student. And so that idea of keeping your eye on the ball, like here and now and 10 years down the road, a lot of people struggle with that. And I remember going through school and sometimes thinking, oh my God, I don't want to take this class. I'm never going to use this. And it's not until much later you realize, oh, all of this was important, you know?
So where did you do college?
So I went to University of Southern Mississippi in Hattiesburg, Mississippi.
I drive through there pretty often. Yeah. Okay, fair enough. They have very loud hotels on game day.
Yes.
I learned that.
Yes.
So majored in biochem, and then at what point were you already on pre-med track when you started?
Yeah, and so that was interesting because in order to be biochem as a major, they automatically slotted me into pre-med.
Oh, interesting.
And I remember having the conversation with my mentor, who was actually my biology professor too. And I was like, I have no intention to do this. And he's like, it's just what they do. It's fine. You know, it just means you're going to be taking these courses. And I was like, okay, but I'm not planning to go to med school. And he's like, okay.
When did you decide? When did you decide to do med school?
It was that same mentor. Thank God. And, you know, and you go through your entire life and you look back and go, okay, that was the mentor who made this happen. And this was the mentor who made this happen. And so Don,
what was his name?
Don Norris.
Don Norris.
Yep. He was the first one to say, you know, I know you say you're interested in forensics, but have you ever thought about forensic pathology? And I said, I don't really know what that is. And so he kind of, as well as he could, he described it.
Interesting.
And I thought, oh, well, that does sound interesting. And so because I had my father as a New Orleans police officer and because things were a little looser back then, I went home for Christmas break and I told my dad, I said, hey, can you get me in to see an autopsy? And he's like, yeah, sure.
Wow. Okay.
Why? And
that doesn't happen anymore.
No, it would not. It would not happen anymore. Not like that. But I said, well, my mentor mentioned this and he thought it might be something I'm interested in. And if you can get me in, I just want to see what it's like. And I went and watched autopsies for my 2 weeks of Christmas vacation. And at the end of it, I was like, yep, that's what I want to do.
Wow. Well, that's a heck of a Christmas.
Yeah. Yeah.
I think it's almost unfair sometimes that some people have this knowledge that the field exists because you knew about it before you even went to med school. That was sort of a deciding factor in going to medical school. And I don't think I really found out about forensic pathology until as I graduated.
Right.
I think we had one lecture from a forensic pathologist and he came in and I didn't appreciate the lecture.
Right.
And so, do you feel like that shaped your med school, knowing what you wanted to do?
Absolutely, for good and bad. On the one hand, I'm stubborn enough and I had drive to know, like, this is my goal. These are the steps I have to take to do this, and that's just what I'm going to do. And my wife always teases me because she's like, you picked one thing, you never deviated, that's it. You never thought about anything else. And I know a lot of people don't do that. But it certainly, in some ways, made it harder because there were, like I said, some of those courses you're going to through, especially at the beginning of med school, where I didn't know enough about it yet. You know, I didn't have any physicians in my family or anything like that. And so as I'm taking pharmacology and I'm going, what is this going to have to do with what I want to do? Not even understanding that, oh, wait, toxicology is a big part of what we do.
Right.
And so, again, keeping that eye on the goal and realizing that all of these steps are important in between, it was hard. It was.
I was just listening to the podcast I did with Dylan Wyrock.
Yeah.
And we talked about that a little bit. And it's some advice that I often give is trying to really focus on what the next step is rather than the outcome of the whole thing. So when you're in pre-med, just really focus on getting into med school. You don't need to shadow autopsies. You can just shadow a family medicine doctor and figure out if you want to become a doctor, because you do have to do that first. And, you know, I think that it makes you, what I said in that episode, and I think I still stand by, is I think it makes you a better doctor, but I also think it makes becoming a medical examiner a lot more fun. Because if you don't decide that you hate pediatrics before you try it, you have a chance of loving it.
Yeah.
And yes, that comes with the risk, quote unquote risk, that you might change your mind and then become a pediatrician, but you could also just enjoy your time learning about it.
Right.
And to me, that was one of the hardest things I had with with residency. So let's jump there. So
Well, I was going to say, before you jump there, you just happened to mention pediatrics, which literally was the only thing as I was going through the 4 years of med school that I sat and said, I could do this. I really enjoyed pediatrics.
what about it?
You know, I don't even know that I could put an exact word to it. It just appealed to me. I loved working with kids. And I just remember thinking, you know, if I didn't have this plan, this is totally what I would do. Now, it may have affected what I ended up doing later, in which I almost immediately, when I got into, you know, forensic pathology, it seems like I almost instantaneously started taking on a lot of the child abuse and neglect cases. You know, and
cases.
yeah, the pediatric cases, and those still are interesting to me. And so maybe there's still a little bit of that in there.
Okay.
So
I mention pediatrics because I often use that when clinicians don't really, they sort of don't understand what we do, or sometimes you'll still hear, why would you want to be a forensic pathologist? You're so good with people and that kind of thing.
Yeah.
I say that what we do is really similar to pediatrics, because pediatricians often don't talk to their patients.
Right.
They talk to the families, and that's what we do.
Yes.
And so in my head, I make a lot of correlation to being a pediatrician, because you have to sort of look at this person in front of you who really can't participate a lot and gather information from their friends and family and the chart and put together a picture and try to do the best you can with that. And so I think there's some corollary. So maybe that's got something to do with it too.
And you're exactly right. The comments that many of us get as we go through the training of like, you're so good with patients. Why do you want to waste your time doing this? And, you know, and my response was a little different as I started to develop how do I respond to that. And I used to say, yes, well, I still have to talk to families, but I also have to talk to 12 people simultaneously, which is a lot harder than talking to one person. So
you've had a lot of sort of focus on the law enforcement, or at least medical legal aspect of the field the whole time.
Yeah.
So do you feel like that's a big driving force for you in the field, is the medical legal aspect? Because I'm going to cut ahead and say right now, so not only are you the president of the National Association of Medical Examiners, and we're at the conference, you're the president of our association right now, but you're also the chair at Mayo.
Well, I'm the program director.
Excuse me, program director. And so to me, when I think of Mayo, I think of hard academic medicine rather than sort of the law enforcement aspect. So do you feel like it's still a big driving force, or has that changed for you?
It kind of changes over time. And I think that a lot of people who first get interested in forensic pathology, that is the drive, is these interesting, as I used to say, sexy cases, you know, like, oh, I saw that on the news, or, you know, people get into the true crime stuff, podcasts and stuff. And I think all of us at first really become interested because of those cases. And then I'd say 10, 15 years later, you know, you start to realize, oh, there's more to this. And now I'll be the first to admit, I still love the medical legal cases, but you know, a multiple gunshot wound case is fairly routine and not necessarily as interesting to me anymore as, you know, this person over here who's young, has absolutely no reason to be dead, and I have to solve this mystery. Yeah. You know, and so I do think it changes over time.
See, that's exactly what I say. In fact, those are almost exactly my examples too, is that gunshots are very, very interesting up until you see them.
Right.
And then it's not really that much of a mystery, because you go, well, what is that hole? It's a gunshot. And then what are the other ones? They're also gunshots. And then why did they die? Is the gunshots. Yeah. You know, it's not a lot of mystery there. And it's interesting in the way that anything shocking is interesting, but that interest dies so quickly. Whereas with the medical stuff, it really feels like a mystery, and you get to put together and use all that information we learned, spend all that time learning, you know. And so I really like that.
And that is where you finally realize, oh, all those other things I did in medical school are important.
Yeah.
Because, you know, another thing I like to tell people is that forensic pathology, in a way, is still one of the last bastions of general practice. Because from case to case to case, you know, it's like, okay, I'm doing a trauma case here. The next case is complications of pregnancy. You know, you've got a pregnant woman who's dead at home, and now I've got to put on my OBGYN hat and remember
Right.
all of that. And then the very next case is, you know, hantavirus or whatever. So you're pulling from all those different categories you had to learn back in the day and didn't really appreciate at the time.
Well, let's talk about what you had to learn, because we have at least one thing we had to learn in common, which was anatomic pathology.
Yes.
So in order to do forensic pathology, you have to do anatomic pathology. Anatomic pathology is the residency. Forensic pathology is the fellowship.
Correct.
And you can add in other things to your choosing, but those are mandatory. How do you feel about using anatomic pathology now? I would say out of many places, you probably do more actual anatomic pathology than most, because
Correct.
you're up at Mayo.
Correct. Yeah. And all of the forensic pathologists at Mayo cover some other responsibilities as well. And so, yes, I still cover a little bit of surgical pathology as well.
Do you like it?
I do. I actually do. And I wasn't sure if I would, because for many years, as you know, I worked in Dallas. Great office, great cases there. But, I mean, we were siloed very specifically in, you know, medical legal death investigation.
Right.
And so being able to kind of step back from that and actually go back and remember some of the other parts of anatomic path, I really enjoy it now. And I think I think getting the exposure in those other areas again has made me overall a better pathologist or forensic pathologist.
So where did you do your AP residency?
So I did APCP at UT Southwestern in Dallas.
Okay. Why
so-
Dallas?
Well, because I did an away rotation as a medical student there at the medical examiner's office and just fell in love with it and said, oh, this is where I want to train.
Was there something that, I mean, they don't just sort of throw those. You had to choose it and request it and work for it. So what drew you to Dallas when there's 50 other places? Nothing against Dallas. I'm just curious.
It actually, you know, once again, it goes to mentors and people you just happen to work with. And when I was talking to the pathology department at LSU, which is where I went to med school in New Orleans, the pathologists there said, oh, well, if you're interested in forensic pathology, they didn't really recommend doing a rotation there because LSU didn't really have that strong a relationship necessarily with the coroner's office. I mean, they had a relationship, but it was different.
It was different. Okay.
But there was a prior student who went to residency and then went on to do a fellowship in Dallas, and they said, well, you should go where Karen went. And this was Karen Ross, who...
Oh, really? Okay.
Yeah, who is also a member of NAME. And so they just recommended. They said she went out there and did her training out there, and she loved it. So you should go check it out. So
what did you think? What was that like? So you're out in Louisiana, and you make the big trip up to Mississippi.
right.
And now you're headed out to Texas,
Right.
North Texas.
We just rode all along the Gulf
Yeah.
Coast, you know.
How? Well, okay. I don't consider Dallas the Gulf Coast.
No, but still.
Okay. All right.
Still.
Texas is its own little country.
It very much
So-
is, yes.
What was it like moving out to Dallas? Were you already married at the time?
We were already married. So Kim and I got married very early. She was just finishing college. She was 21. And I was 22 finishing my first year of med school.
Oh, wow.
Yeah.
Okay.
And basically, at that point, for that 1 year, she was finishing undergrad at USM, and I was at LSU. So we were in different states dating for that year. And so she wanted to move to be with me, and we felt like, you know, if you're going to move to another state to be with me, then we probably should do something about that.
Fair enough.
And amazingly, we've been joking about it. This June will make our 30th anniversary, which just blows my mind.
Oh, congratulations.
So thank you.
So now you're moving out to Dallas with your wife.
Yep.
And does she also have some reason to go to Dallas aside from coming with?
No, my wife is just a very understanding, patient person.
Okay.
No, actually, she got a job at LSU Med Center working in one of the offices, and so when we moved to UT Southwestern or to Dallas, and she was looking for a job, she kind of eventually reluctantly said, "Well, let me just see if there are any positions at UT Southwestern," and I mean, there were a million positions because she had already been working at a medical center for 3 years. So I mean,
Okay.
it was easy for her. So she basically supported me for those residency years.
Let's talk about that. So, residency, having done, let's say 1.5 myself,
Yeah.
residency's hard.
Yes.
I consider it extremely challenging. It's intellectually challenging, certainly. It's more emotionally challenging, I think, because of the sort of time constraint. You know, all of us are getting older. Some of us are older at the time of residency. Some of us just feel like we're getting older at the time of residency. But it's stressful, and the time commitment is really quite different than even, I mean, it's drastically more than med school. And sorry to med students, but that really is true for most everyone, even pathology. And so residency's stressful, and you said she supported you through it.
Yeah.
Tell me more about that. What do you mean?
Yeah. Well, I mean, when we were going through medical school, backing up, I mean, financially supporting, it was like
Oh, wow.
there was only 2 things we were living off of, which was her salary, which at the time was $17,000 a year, and student loans. That was it. When we got to residency, obviously at that point as a resident, you're getting paid. And so we both were bringing in a salary, but so she was still helping support me get through this. But, you know, it's interesting to see that transition of, you started out like with a lot of financial support, but more and more that's not the issue. And then it becomes the emotional support,
Right.
and kind of just, you know, helping you see that every day, like there's a goal, you can do it, just keep pushing through it, you know? But I mean, honestly, there were times in med school, especially at the beginning, where when you know going in that you want to do forensic pathology, there were definitely conversations we had where it was like, I don't know, I'm not sure if I belong here,
Right.
you know? And so to have her there as a sounding board to go, it's going to be okay. You can do this. You know?
I mean, that's great. I think to some extent for me, it was a little bit of imposter syndrome.
Yep.
When I first started med school, I did well in college. I did really well. And so I went to med school fully believing I was going to equally crush it.
Yeah.
And I didn't.
Yeah.
At least not at first. And that crushed me. And so it took a little bit of getting used to it. It's okay to have to learn and to not automatically be the best and that kind of thing. And
Right.
that was a little bit of an emotional challenge for me. And then, man, residency, I think it's some combination of the lack of sleep and just feeling like there is no amount of effort that you can put in that is going to get you where you want to be. Now, ultimately, you're going to graduate, but I mean, you want to be good like all of your attendings are. You want to always know, you want to have the background, you want to have 20 years of experience, and you just can't get it quick enough.
Yeah.
And it was hard for me.
Well, and how many times were you talking to an attending who started quoting some paper from 15 years ago where he's like, oh yeah, so-and-so wrote a paper about this. And I just remember thinking, how do you know that?
Yeah.
Like I'm never going to get to that point. And now we turn around and do the same thing to our trainees.
So if it's reassuring for anybody, it does come, unfortunately, it comes with time, and I don't really think there is a shortcut. I wish there was.
No.
Some people maybe are especially lucky, but I wasn't one of them to just know all that stuff inherently.
Right.
So you did residency. When did you do your first autopsy? Because you saw autopsies really,
I saw them very early. Yeah. So I had already seen, maybe 20, 25 before I even went to med school.
That's
then
wild.
Saw a couple more when I was there. But my first one, and boy, this happens a lot, is that when you come into residency and say, I'm interested in forensic path, you tend to be put on autopsy first.
You get extra autopsy.
Just because they're like, well, we need somebody who's maybe will get up to speed faster, so we'll put him there. So yeah, I would say my first month I was already on the autopsy service for the hospital. Now, back then they had the separation, so you would do a few months of hospital autopsy rotation, and then usually in your third year you would get a month of forensic path. The way we do it now is completely different in my institution, where it's all commingled from the very beginning. But yeah, and then another thing to point out, if we back up for a second, is, and again, this will date me a little bit, is that I came in right at the time when things started to change in the curriculum. So I actually went through a 5-year
Oh, you did the 5-year.
Yeah, APCP, so anatomic and clinical pathology for 5 years. And then as soon as I graduated was when they switched to 4 years. So that 5th year was interesting because it was very nebulous. The intent was they wanted everybody to do some sort of internship, like a medicine internship, surgical internship, so actually seeing patients for a year. Mm-hmm. But then very quickly that morphed where they would say, oh, well, if you're doing a year of research, that counts. Or eventually it just became like, well, you can just do electives for a year or whatever.
I think that's why they dropped it.
And eventually that's why they dropped it. But I ended up choosing a year of neuropathology.
Oh, really?
And it was the best thing I could have done just to prep me for forensics, because I really felt like, by the time I got into my forensic pathology fellowship, I was very comfortable examining brains, which a lot of people, even after 4 years of APCP residency, are kind of like
less comfortable. Yeah. Well, I mean, it's just simply not that many. You only get them from autopsy.
Right.
They don't do a lot of whole brain excisions.
Yeah.
So what was that first autopsy like? Do you remember? Did it affect you? Was it reassuring? Like, this is what I want? Was it jarring?
Right.
What?
So, and when you say first autopsy, the first one I ever saw.
Let's do both.
Okay.
Yeah. What was it like in high school or not high school?
College.
College when you saw those autopsies.
Yeah. So I had no idea what to expect, and so I remember kind of that morning, kind of thinking like, do I eat breakfast or not? I mean, you have no idea what's going to happen or how you're going to react or what you're going to see.
The answer is eat breakfast.
Yes, yeah. And it really is, because I showed up and I couldn't tell you exactly what that first autopsy was now. But I just remember instantly my brain just went into analytical mode and was like, oh, wow, what is that? Oh, wait, tell me what that is. And I was so curious about everything that the emotional part was just completely off the table. It didn't faze me at all. And I tell a lot of people, I don't think there's a lot of people who do what we do who went in and really struggled to get through those first couple of autopsies. I think there's a phenotype where there's a lot of us that just see that first autopsy and it clicks.
Yeah. So I've said that we're sort of a self-selecting group.
Yes.
Right. So we're people that not only chose to go into medicine,
yep,
which is already a difficult field, and I mean that both intellectually and emotionally. It's tough.
Yeah.
Right. So pediatricians, they mostly see kids who are healthy, but they also are the first ones to see kids who are sick. And radiologists are the first ones to see a tumor that no one knows isn't just a cough.
Right.
And so, yeah, we all see difficult stuff. And then we chose to participate in that side where people have died and there's potentially a legal aspect to it. So there could be some violence. There could be some accidental death that's exceptionally traumatic. And so I do think we're a little bit self-selected in that way. But I will admit that there are still occasions where some physical finding or occasionally a story behind the case will actually get to me. Yeah. Does that still happen to you?
Not really, but I don't think it ever did for the most part. I guess I used to talk to a lot of people who would say, oh, I think I could do that job, but I don't think I could handle babies, or I don't think I could handle this type of case. And I never really felt that. And like I said, for me, it just felt like it clicked. There are times when I think things could get emotional, but to be honest, in our practice, we are often very far removed from the instant emotion that the family's going through and all that. We're typically not going out to the scenes and interacting with them at that point.
Yeah, not as often.
Not as often, and that would be harder. So, so I have just intense respect for all of our death investigators and everyone who takes on that role to talk to those families and then follow up with them that same day to ask for permission for organ donation or what have you. Those are tough conversations to have. But no, for me, I don't think there's much that I could point to say, oh, that really bothers me at this point.
So you have to me, I'd call that a very strong professional disconnect.
Yes.
And I say that for me, that's why I really truly struggle with seeing horror movies because I can't deal with the blood. It's too much. Because when I watch horror movies, I don't watch that as Dr. Handberg.
Right.
I watch that as Eric sitting at home on the couch and I'm trying to have a good time. And then this crazy thing happens and I'm not ready to see it. I don't want to see it. Mm-hmm. But at work, I am ready because that's where I'm Dr. Handberg and I can separate myself professionally. And it sounds like you're very good at that, probably better than me.
I think so. And, one of the things that I used to talk to my forensic pathology fellows about all the time, which kind of touches on this a little bit, is that idea of when you go to testify and keeping that kind of separation, because it's very easy to feel emotional enough that you want to, quote, win a case. And I'm like, it's not about winning a case. You're not there to win anything. You need to go in there and you need to present the facts as you know them and the interpretation that you have. But that is your job, And so you have to create that distance because I feel like it becomes dangerous if you become too emotionally attached to some of these cases when you really need to be emotionally separated from that.
Do you have any tips for people? Because it sounds like you're very good at that. Is that a conscious thing or that's just something that you've been good at? I never really had to think about.
I feel like for me, it's mostly unconscious.
Well, I think that it's mostly unconscious for me, but there are definitely cases. There are certain physical findings. A good example is anytime I find teeth anywhere outside of the mouth, that's it just doesn't register with me. It's upsetting, like viscerally upsetting. Or anytime I'm doing an exam and I feel a bone move that's not supposed to, if I don't know if I know it's broken, that doesn't bother me. But if I don't know it's broken and I sort of move it out of place, that's very jarring. And so they give me just a little bit of pause.
Yeah.
But then, some of the stories I find that less so reading the investigative reports, but when I call and actually speak to families.
Yes.
So I do that maybe more often than most because that's part of the job. I don't know if it's the clinician in me still or what, but I do feel comfortable and I like speaking to families because I like explaining things the way I want them explained.
Absolutely.
But I find that still gets to me because
it can. There's no doubt, and I don't want to make it sound like I'm a robot, But I do think those times, when you are in contact with the people that this is affecting, it can be more difficult. But I think again, if you try your best to remain in that clinical mode because you have a job to do, and you still need to be able to. They're going to be upset. That's reasonable. But our job is to help them through that process and explain as best we can, try to give them some closure. That's why the ones that do frustrate us are the ones where the death certificate goes out as undetermined, where you're like, I can't even give this family closure because I still can't answer this question. So
tell me about fellowship.
So, my fellowship or fellowships in general?
Your fellowship, where you did it, and tell me what it was like.
So I did my fellowship where I did residency. So I did it at the Southwestern Institute of Forensic Sciences, which was right there in Dallas, and we were affiliated with the medical school. So, and it was, I think that's where you finally hit. If you've been wanting to do this your whole pathway, and you finally get there, the first thing was this intense relief of I'm finally doing what I was planning to do. And the realization that it's almost over, like, oh my gosh, I'm about to grow up. Because that process is really long, and we say it all the time. I remember being in college and going, if I do this, I'm going to be 31 years old by the time I finish. That's terrifying. And I look back and I'm like, oh, if only I could be that again. But I think, that you just come off of the low of having just taken your boards and you've intensely studied for so long and exhausted, and then to finally kind of turn around and go now into your fellowship you've been planning on doing, work with the people you've been planning on working with, and learn the things you wanted to learn. It was amazingly different because suddenly it almost wasn't work. I mean, I always joke about how I studied for years for the pathology boards, and I probably studied for days for the forensic pathology boards
Yeah.
because, it was what I wanted to do. I was learning the whole time. It was exciting, so very different.
Do you remember any particular pearls? Because I feel like for me, fellowship, we learn so much over the course of all of this training. But fellowship, because that's what we do daily now, that's where I remember a lot of these lessons. And I think a lot of the people I speak to, they have a mentor, someone from their fellowship that would show them a case or tell them something, and it still pops up in your head. Do you have anyone like that, or any phrases or pearls like that?
There's quite a few of them. Some of them I probably shouldn't share on this podcast. But no, I will say, so my mentor at that point was Dr. Jody Barnard.
Okay.
Well, I had two of them there, but Dr. Barnard was the chief in Dallas and just retired fairly recently. And he always had some little pearl, and it wasn't always about the autopsies themselves, but sometimes it was about testimony or what have you, but it was always just the exact right thing. And I loved, what I got from him was his very stern idea of what's an appropriate case that needs an autopsy and what is not. And he always overshot. So if you look at his practice compared to many offices today, he would autopsy way more than many offices. And part of that is because many offices are overworked, understaffed. But he would look at a case and say, the person's 70 years old. And most places would go, we don't need to do an autopsy on this one. He'd go, but I don't know why she died. Right. And the family still wants to know. And he would do it anyway, And I always kind of took that from him. But the other mentor I had in my forensics, which actually, this goes back to when I was in residency too, was Joni McLean, who I don't think you ever met.
I didn't.
But Joni was the deputy chief there for while I was there. And I always credit Joni because, it might have been Don Norris who said you should do forensic pathology, but Joni met me the first day when I visited as a medical student and talked to me and said, oh, what are you here for? Do you want to watch this case? And I didn't run away from the decomposed body she was working on, and so she immediately adopted me. And everything I did over the next 4 or 5 years, I felt like she always had a little part of that, So I'll never forget, and this goes back to NAME, the National Association of Medical Examiners, and my involvement in that. When I was a resident, Joni was the president of NAME. And I walked into her office one day and I said, Joni, I want to be on a committee, which doesn't sound unusual today. But back then, she said, okay, what committee do you want to be on? I said, well, there's a problem because there are no committees that trainees can be on. Mm-hmm. There weren't slots for that at the time. And she said, I don't care. What do you want to be on? And so I said, well, I want to be on the forensic pathology training subcommittee. And she said, great, you're on it. And she created one of the very first trainee spots on a committee. And now you look at all of our committees.
Yeah, now everywhere.
We've got med students, we've got residents. It's fabulous. But, and I didn't have to argue anything or try to convince her. She was just like, cool, what do you want to be on? And, that was my first exposure into sort of the administrative side of NAME and getting involved in those processes. And so, yeah, she was great. And then I ended up, when she retired, she was the deputy chief, and she said, okay, now it's time for you to be deputy chief. And, I always felt like I was kind of following her somewhat.
So now you've done all this training, and at this point, you've done an awful lot of training of training of trainees yourself.
Yeah.
Are there any particular things that you feel like you are especially good at teaching, or things that you like to be the one to share this particular skill or bit of knowledge? What if you had one thing you could give to all the trainees who maybe won't get to work with you?
Sure. Tough question. I will say that not everybody's like this, but I still love evisceration. Just
interesting.
The actual act of doing that. And I know a lot of forensic pathologists, once they get to a certain point, they're like, I'm going to let the autopsy techs do that, and I'm going to just do this part over here. But the act of doing it, I really enjoy. And
so for clarification, evisceration is when we do an autopsy, we start with an external exam where we look at the outside of the body and do identifying features and trauma. And then we do what's typically it's a Y incision. So we do an incision from shoulder to xiphoid and back, and then straight down to the pubic symphysis. And then when we open all the skin up and we take the organs out, that's evisceration.
Correct.
And that's the actual mechanical process of taking things out so that we can look at them. And you're right. Most doctors, most of the time, will let an autopsy tech do that. But do you still often do it yourself?
I do it when I can. And I think part of, and this is one of those things that I try to model for my trainees now, is I always, and this might come from my dad, I always felt like you should never just be standing around doing nothing. And so I remember, talking to residents or even fellows when I was in Dallas and in the training running the training program there, and they would just be standing there waiting for something. And I'm like, what are you doing? And they said, oh, well, my tech had to leave to go answer the back door or, whatever. I was like, okay, so why aren't you doing something? And so I would jump in with them and say, no, let's just keep going. And so I feel like now many of my trainees just see that if one tech goes to go bag up evidence or whatever, it's my habit to organically just step in and keep going. And I feel like that encourages them to do the same.
Yeah.
Or at least see that, respect the practice. It's like, this is a hard job too. You are not too good for it. And I have run into people who have had that kind of, attitude. I'm like, nope, that's not going to cut it. But the other thing is, going back to your question about what do I like to teach, within that, I love to teach specific dissections that are more technical and the things that we do specifically in forensics. So like posterior neck dissections or, nuanced kind of dissections. I really do enjoy doing and teaching that part of it myself instead of saying, oh yeah, go stand over there and let the tech teach you how to do that.
That's cool. I think everybody finds some niche that they're especially interested in themselves, and I'm going to give you the credit and assume that you're probably exceptionally good at those things, and so that's what lets you teach people and show them the right way to do it. I am still finding all the things that I like teaching. I honestly, the thing I like doing more than anything is I like talking about the field, thus all of this.
Yes.
And I really like encouraging people to maintain the attachment to being a doctor.
Yes.
So keep thinking about this. Our decedents are people with families, and they're our patients. And, I like knowing their name. I like knowing their story. I like speaking to their family to close that loop, because at some point in your life, you've probably had a doctor who was a bad doctor. And almost always the way they were a bad doctor is they didn't talk to you.
Absolutely.
And I don't want to be that bad doctor. And so I like to encourage people not to do that. And, I do training in evisceration and things, but I take the most pride, I think, in the doctoring side.
I think that's great. And it touches on something that we all saw in medical school sometimes, which was, I remember being in surgery, and I'm not saying all surgery practices are like this, but oftentimes they kind of are because they're very busy. And I don't know if you had this experience where you're, on the ward and you have 15 cases that are going to go to surgery today. And as you're going through rounds in the morning, it literally was like, okay, well, we've got the cholecystectomy in room 1. We've got the appendectomy in room 2.
Right.
And it was like, I don't know any of their names.
Right.
I don't know any of their stories. It's just procedures. And that always did bother me. Yeah.
Every field has their own style, and my style. And that's part of the reason I do the podcast is so that people can hear that my opinions are my opinions, but they are nonetheless my opinions. And I try to have people on who will occasionally have different opinions than me. And so I think that that's very important. But obviously some surgeons feel like their job is truly to do the mechanical aspect. And that's great. If that's successful for them and their patients, then so be it. But that's not the kind of doctor I want to be.
Right. And again, I'm no shade on them, because a lot of that is the nature of the practice. When you're overwhelmed with that much work for that day, there's only so much data you can accumulate, right? So you kind of have to pick and choose what parts of these things do I need to know before I go in for my day.
So I think we're getting close to the end of our hour here. So there's a couple of things that I want to ask. If you can, we have a very unique window where we see a lot more violence, a lot more intensity, a lot of death, a lot of really unfortunate situations, more so than even most doctors.
Yes.
Do you feel like that's affected you? Has it changed your life or any way that you live your life?
It's a really good question, and I think it has. It has. Now, my kids would say they're always sick of me telling them, "Oh, you shouldn't do that because I saw a guy die that way." You know, but I think if anything, it's made me less judgmental, if you will.
Interesting.
Meaning that I think everything seemed very black and white to me, good and bad, you know, before I did any of this. And then when you really dig into some of these cases, and you kind of find out these people's stories and all, you start to step back and go like, wow, that was a really tough life they were living. And, you know, like, it's so easy for somebody to say, well, we got another drug overdose.
Yeah.
And just kind of be, whatever. But, you know, to remember, there's a lot more going on there. And so I feel like it has changed my overall approach to how judgmental I am to people, you know, live people
Yeah.
who are experiencing these things, you know, where I don't automatically think like I did when I was a kid, like, oh, that guy's a drug addict. You know, I mean, there's so many stories we just
true.
don't know.
Yeah.
So
I think that's very thoughtful. And because we're at the end, I know we talk about a lot of training and a lot of medicine and a lot of death because that's the nature of it. But I do like to talk about something fun at the end.
Yep.
And I'm going to ask you a different question than I've ever asked anyone else is, how did you become a magician?
Which is a great question. So easy answer in a way. So almost all magicians have the same story, which is I was about 7 or 8 years old, and you know, my uncle or my grandfather or somebody bought me my first kit, you know, and that's what got me started. Mine's completely different. In fact, most people would say I was a late bloomer, but it was medical school. I actually was on a cardiothoracic rotation as a medical student, third-year medical student.
Okay.
And one of the retired surgeons would come in and do these small group chats with us. And he would come in and say, all right, today we're going to do a chalk talk for 20 minutes on pulmonary hypertension or whatever. And then at the end, he'd start doing magic tricks for us. And I was like,
story.
what is happening? And it turned out he had a bunch of grandchildren, and so he would practice stuff on us and show us things and then take it home and work on it. And I remember going home and saying, this is just so interesting. And my wife and I were talking about it, and I realized my next rotation after that was pediatrics.
Oh, perfect.
And I thought, I wonder if I should learn something from this. So I went and talked to him, and he explained, he's like, oh yeah, there's books and there's this and that. And that's kind of what got me interested. And my wife and I both naively thought, this is a great hobby. It's simple. It's cheap. You buy a couple decks of cards, a couple of books, you're good to go. Yeah.
That's not
how
the
it
case.
worked
Okay. Well, thank you very much for being part of the podcast. I'll just have you email me any contact information
Sure.
that you want to share. It's not mandatory, but if you do want to share it, you're welcome to. Anyone out there, thanks for watching, listening. If you're interested in what we do and you want to learn more about being a forensic pathologist, you can go to reddit.com/r/forensic pathology. I do recommend you check out the National Association of Medical Examiners website. That's thename.org. There's lots of good information about what we do. There's also lots of good educational information. So please check that out. If you are interested in forensics and you're not sure you want to do all of medical school and all that, you can also check out a lot of very important, very cool adjacent fields by checking out reddit.com/r/forensics. And otherwise, we'll see you next time.